A peptic ulcer is a type of sore or erosion that forms in the lining of the stomach or the first part of the small intestine, known as the duodenum. Peptic ulcers can be caused by a bacterial infection, the overuse of painkillers such as aspirin and ibuprofen, or excessive alcohol consumption. Stress and diet are no longer considered to be direct causes of peptic ulcers. The most common symptoms of peptic ulcers include abdominal pain, bloating, nausea, vomiting, and a feeling of fullness or hunger. These symptoms may come and go and can be relieved by eating or taking antacid medications. In some cases, peptic ulcers can lead to complications such as bleeding, perforation, a hole in the stomach or intestine, or obstruction, blockage of the digestive tract. Treatment for peptic ulcers typically involves a combination of antibiotics to eradicate the bacterial infection, acid-reducing medications to reduce the amount of acid in the stomach, and lifestyle modifications such as avoiding foods that irritate the stomach lining and quitting smoking. Surgery may be necessary in severe cases or if there are complications. Peptic ulcer definition. A peptic ulcer is a type of sore or erosion that forms in the lining of the stomach or the first part of the small intestine, known as the duodenum. Peptic ulcers can cause abdominal pain, bloating, nausea, vomiting, and other symptoms. They can be caused by a bacterial infection, the overuse of painkillers such as aspirin and ibuprofen, or excessive alcohol consumption. Treatment for peptic ulcers typically involves antibiotics to eradicate the bacterial infection, acid-reducing medications, and lifestyle modifications such as avoiding foods that irritate the stomach lining. Peptic ulcer causes. Peptic ulcers can be caused by various factors, including Helicobacter pylori infection. This is a bacterial infection that commonly affects the stomach and small intestine. Pylori bacteria can weaken the protective lining of the stomach and duodenum, leading to the formation of peptic ulcers. Nonsteroidal anti-inflammatory drugs, NSAIDs. These drugs, such as aspirin and ibuprofen, can irritate the lining of the stomach and small intestine, leading to the development of ulcers. Excessive alcohol consumption. Alcohol can irritate the stomach lining and increase the production of stomach acid, which can contribute to the formation of ulcers. Smoking. Smoking can also irritate the stomach lining and decrease the production of protective mucus, which can increase the risk of ulcers. Stress. Although stress is no longer considered a direct cause of peptic ulcers, it can worsen symptoms and delay healing. Zollinger-Ellison syndrome. This is a rare condition in which tumors in the pancreas or duodenum cause the stomach to produce too much acid, leading to the formation of ulcers. Other medical conditions. Certain medical conditions such as Crohn's disease, liver disease, and kidney failure can increase the risk of peptic ulcers. Peptic ulcer symptoms. The most common symptoms of peptic ulcers include abdominal pain. The pain is typically felt in the upper abdomen and may be described as a burning or gnawing sensation. The pain may be worse when the stomach is empty and improve with eating. Bloating. Some people may feel bloated or full, even after eating a small amount of food. Nausea and vomiting. These symptoms may occur if the ulcer is severe or if there is a blockage in the digestive tract. Loss of appetite. Some people may lose their appetite or experience weight loss due to the discomfort caused by the ulcers. Heartburn. This is a burning sensation in the chest that may be felt after eating. Belching. Belching or burping may be more frequent due to the increased production of stomach acid. Dark or black stool. This may indicate that there is bleeding in the digestive tract.